soon as I got the topic, this morning topic, I was wondering what kind of interesting lecture I'm going to give to you as a dermatologist. But frankly, I like to start from this initial slide. These are my disclosure. And I like to start from the famous poet because you've been so provocative with me about Purgatory and Inferno. And Dante Alighieri is a famous personality in the Italian history. And let's see if we're going to reach the answer to the organizer question. So moving from Purgatory to Paradise, avoiding Inferno. And this is a true story in the Divine Comedy, the Divina Commedia, the famous book I suggest you to look at. And I found very interesting this slide looking at the Inferno picture with several turns, as you can see, going into a very geometric aspect, which you can correlate with the diabetic foot ulcer on one side and the soul, which we're going to try to solve in the lecture. And this is the Inferno. You're going to see in the next 2 or 3 days. Those are two patients seeking for a treatment in our wound clinic, very desperate patients, so Inferno. But we're going to go from Purgatory to Paradise from this one. And this is the Purgatory, so we're going up with several circles. Once again, Dante with friends to Paradise at the end with the soul salvation. And as a dermatologist, we like also to improve the knowledge in our specialty, and Dr. Armstrong was very inside this recent paper on the Journal American Academy of Dermatology, looking at continuing medical education for pathophysiology prevention and also management. I like to say that I'm so lucky to work in a great hospital where there is a great diabetic foot unit led by your friend and our friend Alberto Piaggesi. And this is the organization of the Diabetic Foot Clinic in Pisa, and where we see the dermatologist's role is mainly here in screening the diabetic foot, and then there is a strong collaboration on therapy and follow-up and back on therapy. So looking at screening as a dermatologist, we can enter several directions, particularly wound assessment and skin assessment. And because of the time, I'll touch briefly on wound assessment, giving the opportunity to some interesting research aspect we're doing at this time in Pisa. Wound assessment, mainly 2-dimension and 3-dimension, is a special aspect in wound management, also in diabetic foot, which is in between several interdisciplinary topics like prediction of healing, documenting, imaging, but also systemic. We heard about biochemical factors, so different aspects rotating into a single direction. The main purpose of wound assessment listed in here, the initial diagnosis, but also support for clinical decision, monitoring for infection, quite inside in diabetic foot management, but also efficacy of treatment and prediction of outcome, and of course reimbursement. But how do you currently assess your wound? How do you measure that? Very difficult to measure diabetic foot wounds. How accurate are your measurements? How do you use this information in the daily practice? There is something there. This is a subspecialty, as you can see. This is a book published a few years ago, dealing mainly on techniques for wound assessment, which is becoming today more and more a very simple, accessible less and less invasive, very reliable, easy to use in the clinical setting, and of course, a cost-effective discipline. We started many years ago from different type of measuring, like linear tracing with grid, and moving to over an electronical grid. And we know that wound size assessment at 12-week looking at healing rates is going to differentiate between healers and non-healers in diabetic foot management. But at this time, this is the option for us as a dermatologist, because we're talking about skin, not only skin, but in dermatology, we're quite inside of non-invasive diagnostic assessment. As you can see here, different devices, skin is very accessible. We've been moving to the arena of wound healing, and this was a paper we contributed a few years ago looking at the time concept, which we modify according to wound assessment. As you can see, the in between blue color column are now modified according to wound bed preparation, non-invasive measurement, and the effect of those measurements on wound bed preparation, looking at tissue, infection, moisture, and edge. So some kind of clarification among devices which are becoming more and more user-friendly, as you can see here. And particularly on the diabetic foot, where you have to deal with the very difficult to shape wounds. We learned from the literature, particularly in diabetic foot, that the depth measurement is unreliable in deep irregular shaped wounds, and also depth measurement is less reliable than volume and area. A few years ago, we've been participating in a European Union funded project dealing with a three-dimensional wound imaging. Mainly there was a prototype of software and device looking at venous leg ulcer, but also diabetic foot ulcer. And this is a video showing at that time what we've been doing, an acquisition, three-dimensional acquisition with laser scanning. Then the software is going to detract the loosened part, the wounded area, and calculate the wound volume, but also you've been able to calculate any other wound size parameters, such as circumference. But particularly, we've been able to clarify the so-called color defragmentation, touching on a single point on the wound and matching the color tone. We've been able to differentiate at least the three major colors. So that was back in 2007. Now we rely with more portable devices such as this one, which is becoming the gold standard in our unit, a very portable device able to connect far centers with the center of excellence because of remote control assessment. But as I said, in dermatology, there will be more and more opportunities on not only on wound assessment, but also on wound diagnostics, particularly from cutaneous pathology. We heard already some interesting aspects on diabetic foot pathology. We contributed together with Alberto Piagesi on a similar paper to the one we have heard, looking at the semi-quantitative analysis of the histopathological features of the neuropathic foot ulcers. And with that paper, we've been able to correlate the role of loading with some interesting histopathological findings. And this is our new challenge. I suggest you to look at the website. The acronym is for SWAN Eye Care, Smart Wearable and Autonomous Negative Pressure Device for Wound Monitoring and Therapy. This was also an honor for us at the University of Pisa. It's a multi-million funded European Union project into the 7th framework, which is looking at nanosensors, as you can see here, either in diabetic foot ulcer and venous leg ulcer, using negative pressure and monitoring those sensors in a remote way. But as you can see, we will be looking at a very sophisticated type of parameters, not only temperature, pH, something very familiar for you in the audience, but also more sophisticated, such as TNF-alpha and other interleukin and also angiogenetic factors. This is a 4 years term project run by a consortium of 6 countries in Europe. So for us as a dermatologist, we see a brilliant future in diagnostics, not only in pathology, but also tissue samples like flow cytometry analysis, microdissection, but particularly in genomics and proteomics, which will be the future of diagnostics. And I like to finish my short purgatory to paradise, moving from wound assessment to prediction of healing, together with improved documentation and decision-making, and particularly improved patient outcomes. And because of Dante Alighieri, we like to invite you for the only event in 2016, the so-called World Union of Wound Healing Societies, which will be held in the beautiful city of Florence, the city of Dante Alighieri, in September. Thank you very much.